Hi everyone, my name is Joe Russo. I'm a senior director here at Edson College. I oversee our community professional and global education programs. I'm a public health scientist by training, and while I've worked on a lot of different kinds of health topics, for me, home will really always be reproductive health, and particularly how in our system here in Arizona, we address access to services. Typically, when we talk about access to any type of healthcare, the conversation tends to center to start with really naturally around geography. And I think that this is a particularly relevant conversation for us to have in a state like Arizona. I think all of us know, in both urban and rural communities here, we're just so spread out. And so as a health system, as health systems, just as much as the size of our population, we're often kind of wrestling with the size of our space, and especially the space between people, between communities. It can present some unique challenges in this part of the country. One of the ways that we describe those challenges is through the vocabulary of what we call deserts. And I imagine that these are terms that you've all probably heard. Resource deserts, healthcare deserts, even food deserts, it's all the same idea. And it's an old idea, really just let's look at where are the resources, where is the need, how do those two align, but most importantly, how do they not? Where are those gaps? Now, where are the resources? That's usually the easier question for us to answer. You know, that information's out there, it's accessible. And if we're talking about health facilities, we're putting data on a map for analysis, an address is about as simple as it gets to just pop down a pin. It's great. Where is the need, on the other hand? Well, that's where things get a little spicy. Because need is so nebulous. It's something that we have to define ourselves. And there's a lot of really valid ways that we could define it. I think we all know an analysis is only as good as the data that we feed into it, the assumptions we make. Similarly, the answer to a question really only as good as our ability to be asking the right question in the right ways. Some of our latest work here at Edson related to this kind of topic. We're doing some really exciting things around mobile health services. We have a new mobile health unit that's going to have a particular emphasis on reproductive healthcare. Really exciting opportunity alongside some community partners to get out and understand what need actually looks like in Phoenix, while also, hopefully starting to serve some of those underserved communities. Again, it's work we're very excited about, but in terms of access, it's really just kind of the first piece of the puzzle. I'd like you to imagine that I am standing on the banks of a river that I believe is too deep, too dangerous, too fast for me to cross. And the question I would pose to all of you is, can Joe cross the river? You laugh, because it's kind of the wrong question, right? Can Joe cross the river? It asks a lot about the river. Like how wide is it? How deep is it? Is there maybe a nice safe bridge that's just out of my sight around the bend? The reality though is, I think as we all know, if I don't know the way across, I don't have the means to find it on my own, and I don't have anyone to help me, can Joe cross the river? Yeah, sure, I guess. Will Joe cross the river? Well, likely not. And so what we know is I may live across the street from a health center that offers a life-changing, or let's say even life-saving service. And if I don't know that it's there, or maybe I don't understand that it's something I could need or benefit from, distance is not the issue here. Similarly in reproductive health, we're not just wrestling with health literacy awareness, but also attitudes, beliefs, stigma. Let's say I have every intention of seeking out reproductive care, but I'm uncomfortable, I'm nervous, maybe I'm just scared. This is very vulnerable care type of health for, I think, most of us to a certain degree. And maybe in that vulnerability, what you just heard about, maybe I've had a bad experience with a provider or even front office staff who are rude or judgmental. Those are bridges that we have to repair before we can use. And finally, on top of all of that, maybe I'm facing risk, however big, however small, that setting foot in that building might get me judged, punished, maybe even ostracized from my community. And what we know is, for me, a patient, but also a person, a human being, these kind of social factors, they present just as tangible barriers to my access as geographic distance. and sometimes maybe even more tangible. What we see all the time here in our reproductive system in Arizona, especially in our rural counties, is that a patient like me, if I have the means, well, social factors may lead me to get in my car and go to the next town or even the next county over to seek care deliberately really far from where I live. It's understandable in context, but it's human behavior. It does kind of highlight the trap that we can fall into as system scientists of, well, we just need to look at the map, we need to find all the blank spaces, and we just need to fill them in. Right? Because maybe not all deserts are just geographic. Part of this is a patient public education issue. Again, it's health literacy. What is health? What resources exist to support my health, and how do I access them? Right? We're trying to lower that barrier to entry. But the other piece, and again, this connects perfectly with the presentation you just heard, it's a professional and a provider education issue. How together across our disciplines can we rise above this kind of bare minimum of just present? And how can we ensure that our spaces and our services are safe, trauma-informed, patient-centered? How can we be culturally competent, confidential, which by the way is different than just being HIPAA compliant? How can ultimately we be welcoming in our care? Finally, I just want to take a moment, I'll touch on policy and systemic barriers. I don't think it's a hot take to just acknowledge that reproductive health is a particularly complicated topic in our policy landscape, especially in the last couple of years. There are a lot of reasons for that, and I promise my dean I won't dig into most of those today. But I do think one that is really easy to underappreciate or acknowledge is the sheer amount of policy that is created, codified, and then implemented every year without much direct, meaningful involvement by health professionals and experts themselves. A big part of my work here at Edson has been to help create courses, workshops, presentations about the different ways that health professionals of all disciplines, all backgrounds, can get meaningfully involved in the policy conversation. Local, state, even federal levels. Advocate for ourselves and our work, but most importantly for the patients and for the communities that we serve. Something we say in that world is, if you're not at the table, well then you're on the menu. I'll close with this. I speak a little bit of Mandarin, emphasis little, and between us, not very well. But one of my favorite things about the language is when you're first learning, something you're typically taught as a beginner student, is that there are 3 ways to say that a person can do something. There's 3 verbs that mean can. The first is the word that you would use if you're describing what one is physically capable of doing. Can people access the care they need? The second word, well, that's what you'd use if you're describing what one has the knowledge or the learned skill and ability to do. Can people access the care they need? And the third word, well, that's what you'd use if you are discussing something that one has permission or the right to do. Can people access the care that they need? Access to care is it's a really complicated topic. It crosses disciplines, and the solutions are typically very involved, multifaceted. It's not easy work, but I do believe that if we work together, we try our best to ask the right questions, and if we're really deliberate about addressing all different kinds of barriers, that better access is something that we can provide, bit by bit. Thank you.